Hi everyone. We'll probably get started here in a couple minutes. Just giving some time for people to join. All right, well, I guess we'll get started here. Hi, my name's Dr. John Adam. Just a little bit about myself. I've been a veterinarian for about 17 years now, pretty long time. And just a general practice companion animal, dogs and cats. The reason why I'm doing this presentation today is one of my big advocations for the, uh, the the field, as well as something that I think is lacking as well, is client communication. Client communication, I think, is key to our patients and pets' health in general. The more educated a pet owner is, the better we can um, take care of these animals and pets, and just make sure um, they are living the healthiest as they can. So with that, I started a YouTube channel to go over certain topics and issues, and I've also started a community as well in school, which I'll go over later, that hopefully provide a safe and good environment as far as sharing information, asking questions about your pets, and making sure you have proper information, not all the mumbo jumbo you see on social media and on the internet nowadays. Just reliable sources of information. Um, so with all that, we'll get started here on the topic for tonight, and the topic is allergic dermatitis. We're in a season of the year, especially here in Southern California, that allergies are a big thing. So definitely something to go over, and I know it's a major pain point for a lot of pet owners, and a lot of frustrations, not only us as veterinarians, but to pet owners as well. So going over that and understanding that I think is key to success of managing allergies. Um, so, what is allergies? I mean, allergies are if your pet's been itchy, irritated skin. That's what we call allergic dermatitis. You're licking their paws, getting constant ear infections, then you're in the right place tonight. That's usually the underlying issue is an allergy. So I'm going to go over this presentation today or tonight, and then later on we'll probably go over some questions that you can put in the comments. Please bear with me. This is the first time I've done a live event, so there might be some technical difficulties in doing that. So I apologize if there's any issues, but I'll hopefully figure this out. But we'll probably do questions at the end of the presentation here. So, all right. So allergies. So picture this: your dog's flops down and then comes a scratch, 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 or that thump, thump, thump of scratching their ears, the midnight licking the paws that keeps you awake, and gives you the heebie-jeebies, that's your pet, then you're in very good company tonight, because that's a lot of pets. And we see this a lot. This is probably one of the biggest reasons we see dogs and cats is for allergies. A key reframe tonight is that itching is not just a quirk of habit. They're not doing it because they're bored. There is a reason, there's an underlying reason that we'll be decoding tonight. So we think, or pet owners usually think of skin allergies as a skin problem. It's much bigger than that. It's actually an immune system problem that we see on the skin. The immune system overreacts to something, whether it be parasites like flea bite, ingredients in the food, something in the environment like pollens or trees, wherever that may be. So the immune system overreacts. That causes inflammation on the skin, and that inflammation on the skin starts the itch cycle. And then you get the scratching, the licking, the biting, and then starts damaging the skin. And then we start getting this cycle of infections and chronic inflammation, and that's when everything begins. There's usually three big categories that cause allergies, which we'll go over here in a second. And many pets have more than one of these. Most time it's multiple of these, sometimes all three. So the three big categories that we see are parasites or fleas, food allergies, and environmental allergies, such as dust, pollens, trees, grasses, stuff like that. Like I mentioned before, excuse me, a lot of these dogs and cats will have multiple allergens, not just one, and could be in multiple categories, sometimes all three. My own dog has all three of these, and he's bad with fleas, he's got food allergies and environmental allergies. So big picture of that is that it does take some detective work to work this up, and it does take some time. So be patient with your veterinarian to get this sorted out, and work with your veterinarian to get this sorted out as well. But let's see what the signs are for allergies and when you should bring your pet in. So obviously the main thing is the constant itching, scratching, licking their paws, chewing at their paws. With lighter coat animals, you'll see like this red tinge on their paws, and that's from the staining of the saliva while they're licking. So if you're seeing that, that is a telltale sign of licking paws and allergies. You might even see red and inflamed skin, especially on the belly, armpits, the groins, obviously in the paws. It can be anywhere though, including in the ears itself. Other things that you start seeing, especially after they're scratching and chewing and all that, they'll be damaging their skin, their hair. They'll get some hair loss, bald patches. Like I had mentioned, recurring ear infections. That's very, very common in dogs. It's one of the most common reasons for recurrent ear infections in dogs is allergies. Cats can get it as well too. It's not the most common thing for ear infection in cats, but it is a big one as well. Sometimes it can get bad enough where you get something called hot spots, which are these raw, moist sores that flare up really fast, sometimes within hours. And of course, we obviously want to take care of that when that happens. Bottom line, itching is a medical sign of an underlying, usually allergy, and on top of that, usually infection as well by the time you bring them into the veterinarian. So if you're seeing that, don't wait, bring them in. They're not bored. There is something going on. So we'll go over each category of allergies one by one. The first one is fleas or parasites. This is probably the most common skin allergy we see in dogs and cats, and it's the one that most people miss. Um, they're usually reacting to the saliva from the fleas biting them, and that causes a reaction. And it only takes one or two of these fleas biting them, and they can be itchy for days, sometimes weeks. So just because you're not seeing fleas doesn't mean we don't have a flea issue. In fact, most of the time when you start seeing fleas is when you start having a bunch of them, thousands of them in your environment. So the key is to never see them. Usually, where they're scratching and itching the most is, or chewing, is in the lower back, base of the tail, back of the thighs. In cats, they might have like tiny scabs around the neck and their spine. Sometimes you'll see the fleas on their belly as well. Um, like I mentioned, yes, for this is something that can be year round, not necessarily just in the spring and summertime, especially in areas like Southern California, where it doesn't get cold enough for it to be not fleas. So fleas in most places are going to be a year-round thing. There are going to be areas like Minnesota, where it's super cold during the winter, where fleas will be less likely, but you also have pets that are indoors. Fleas can go indoors and thrive indoors. So it's still recommended to take care of fleas year round. Good news though with fleas is that it's probably the most preventable allergy out of the three. And that's with year-round flea control. This is how we treat, but also test to see if we have a flea issue, is by getting a lot of good flea control. And that's where we always start, is with a good flea control. One second here. So with flea controls, we mean prescription flea controls. Now there are over-the-counter flea controls. Those are great back in the day when they first came out, because before that we had nothing. So even though they don't work too well, as far as they take forever to kick in, they take forever to kill the fleas. It was better than nothing back in the day. But now we have so much better flea controls out there. The main ones being the isoxazolines, which are the oral flea controls. A lot of you may know the NexGards, Simparica, Bravecto. There's other ones like Credelio as well, that are either given every month or every 3 months, and they are amazing. They work real quick. They're very safe. Majority of the times, obviously, discuss it with your veterinarian before putting your pet on these. But majority of times, these are the go-tos for dogs, even cats as well. Another one that we use is Revolution. It's an older one. It is not like the oral flea controls, but it is a very safe flea control that also takes care of heartworms and ear mites and mange, and is a topical flea control that you can use as well. So these are usually the prescription ones that we recommend people get. Next thing is food allergies. Food allergies. There's a couple myths about food allergies. One big one that we hear a lot as veterinarians is grains being a major allergen. Now, can't say that in no dog or cats much grains. There are some that does happen, but it's very rare. Usually the common allergens are animal proteins, such as beef, chicken, dairy, eggs. So grain-free is not really a thing. In fact, a lot of grain-free diets are linked to heart disease. So a lot of veterinarians are not going to recommend a grain-free diet. because most of the time it's not going to help out as far as for allergies. And on top of that, there is potentially a major risk with the heart. So most of the time, we're not going to be recommending those diets. Another big myth for food allergies is that pets don't get allergic to the food they've always eaten. And in fact, that's the opposite. Usually, they're going to be allergic to something they've been exposed to. They don't get allergic to something that they're not exposed to. And so, even though your dog or cat may have eaten that food for their entire life, they can develop an allergy later on to it, which is frustrating. And so, we do need to look into that if we're suspecting food allergies. With food allergies, obviously, since they're eating that food, it's usually a year-round thing. It's usually pretty consistent. A lot of times, the medications we use for allergies aren't as effective with food allergies. So we may be looking into it if we're not having good control with the treatments we use for allergies. Another big tip for allergies, food allergies, is if they're having any gastrointestinal signs such as soft stool, increased gas, vomiting, even though it's infrequent, like once or twice a week, that can be a sign that we have a food allergy affecting not only the skin, but affecting the gastrointestinal tract as well. How we diagnose food allergies, there's no blood tests, saliva tests, hair follicle test that does that. The gold standard for food allergies is an elimination diet trial, which is a strict special diet, usually a novel diet, so something they've never been on as far as the ingredients, or a hydrolyzed protein diet. So it's a diet that's specifically made where the proteins are broken down so finely in the diet so the body doesn't recognize it, whatever it is in the diet. And we usually do that for about 2 to 3 months, so 8 to 12 weeks, and see how they respond. And that's usually how we diagnose food allergies. Next, Gary, the third category is our environmental allergies, or what we call atopic dermatitis. This is very similar to eczema in people. It causes chronic itchy, inflamed skin. Usually their skin barrier is very weak, and so the allergens will go through that and cause that inflammation and irritation that we see on the skin. Sometimes it is a genetic thing as well that can cause them to have these allergies and poor skin barriers. One second. Sometimes it can be seasonal, depending what they're allergic to. A lot of times it can be. Although here in Southern California, there can be something that they're allergic to all year round. So just because it's not seasonal doesn't rule out an environmental allergy. But if it is something that seems to come in during a certain time of the year, that is highly suspicious of a seasonal allergy. Usually we're seeing issues on the face, the paws, ears, armpits, the belly, areas that are in contact with the ground, especially if they're allergic to like grasses and pollens and all that. Relentless paw licking is a hallmark of usually environmental allergies as well. The key to environmental allergies is, and any allergy, honestly, is that we're not curing these allergies. We're managing these allergies best we can. So keep that in mind. That can be frustrating because you're going to have flare-ups from allergies. The key is during our treatment is to try to limit the amount of times they have flare-ups of allergies and limit the amount of times you have to come into the veterinarian to take care of those flare-ups. But this is a lifelong thing. You're always going to be dealing with it. We just try to manage it as best we can. So allergies in itself can cause secondary issues because of all the scratching and licking and the inflammation on the skin. And that includes certain things like infections, ear issues, stuff like that. And so a lot of times that is the reason why you're coming to the veterinarian, is to take care of those secondary issues, such as, a smelly ear or sores on the skin or little pustules on the skin. And that is probably the first thing we will do when you do visit us. So things you'll see with these secondary issues, infections, and all that, like a bacterial skin infection. You might see little, like I said, pustules, crusts on the skin, bad smelling skin, especially if it's a yeast infection. You'll get that kind of corn chip smell to them, and maybe a little greasy, a little musty. Repeat ear infections, like I mentioned before, those are usually because of an underlying allergen of some sort. So taking care of that allergy is our number one priority with ear infections that keep coming back. Like I mentioned before, the hot spots, those are those raw sores that can come up real quickly if they're just scratching and chewing constantly and just damaging that skin barrier. Eventually, the skin can darken and thicken. It's what we call elephant skin, when we have that chronic and inflammation of that skin and it just hardens up. It's just not comfortable for your pet and not comfortable for you as well. So we'd like to take care of it before it gets to that point. So when you do come in, we do have to clear that infection. But we also will have to have a plan for you to hopefully manage these allergies. And usually there's three kind of pillars of what we try to do when we're trying to take care of these allergies. So the number one pillar is try to remove the trigger. So if it is fleas, you want to go flea control. If there's a food allergy, getting them off that food allergen, whatever it is, so putting them on a therapeutic diet for that, doing that food trial. With environmental allergies or atopic dermatitis, we have immunotherapy. So basically what we do with that immunotherapy is we inject a small amount of the allergen into the system so that eventually, hopefully, the immune system will recognize it as non-threatening and normal, and so won't react to it as much. Once again, this isn't a cure. It's just going to hopefully dampen that immune response to the allergens to the point where you don't have to do as much medications or keep bringing them in for flare-ups. Our next pillar of treatment is to calm the itch. We nowadays have so many choices for that, which is amazing. Before, we didn't have that many choices to calm the itch down, but we have very specific treatments for that nowadays that do help not only short term but long term in that itch and just increasing the quality of life for these pets with these allergies. Our next thing that we do is we try to heal that skin barrier, especially with atopic dermatitis. And this is usually with things like medicated baths or topical therapy of some sort. Omega-3 fatty acids. That is one of my favorite supplements is omega-3 fatty acids. They are not only good for the skin and help rebuild the skin and decrease that inflammation in the skin. It's also good for their joints, their eyes, or hearts. So I love that supplement and always recommend it, even when they're puppies. Just get them started on it because it has so many benefits. And of course, if there is any secondary infections or anything, We want to take care of that because that's also causing damage, causing inflammation, and scratching as well. Um, Most of the time, we're going to be doing a combination of all of these things. So there's not one treatment that we can do that's going to take care of everything. So this is a what we call multimodal, or a multiple steps as far as trying to control these allergies. So as far as the medications that we have to stop the itch, two big ones or newer ones that we have are Cytopoint and JAK inhibitors. Probably the biggest one people know is Apoquel. There are other ones that have come out like Zenrelia. Um, there's Zenrelia as well. So there's other ones that are coming out as well that help with that itch. So with Cytopoint, um, there's been a kind of a huge breakthrough in medicine with these monoclonal therapies, and what it is these antibodies that will attach to specific either receptors or molecules, whatever it be. In this case, Cytopoint attached to a itch signal called IL-31, and so when it binds to it, it prevents it from binding to the receptor it needs to activate that itch cycle. It's very safe. Minimal side effects with it. Can give it to very young dogs and old dogs, even if they have other issues or other medications. It's usually a very safe medication to give. It's usually given every 4 to 8 weeks, usually 4 to 6 weeks, but can last up to 8 weeks. Um, the JAK inhibitors, they are different in the fact that they block a signaling in these cells that drive itch and inflammation. They work pretty fast, and they are a lot of times used just to take care of the flare up of the itch, but also sometimes, or a lot of times, we'll use it as a chronic medication to help with that itch, especially if Cytopoint doesn't work. Sometimes we have to use both Cytopoint and a JAK inhibitor together for some dogs and cats. Well, not cats. We don't really use these. Unfortunately, we don't have too much in the way for cats, but in dogs, these are huge medications that will help with that itch, and with the JAK inhibitors help with that inflammation as well. Another older medication we don't use as much anymore, but still is used to this day. Cyclosporin, or the brand name is called Atopic. It's still a very valuable medication. It calms a specific immune cell-driven reaction to allergies, T cells. It does take about a month to a month and a half to kick in. So initially, you're giving it every day for at least a month, and then we evaluate and see how they're doing. And if they're doing okay, we actually try to back off from it, usually taking a day out of the week. Like every Monday, we don't give it, or every Tuesday, whatever it would be, and try to lower the dose as much as we can, not only for just the lowest amount of drugs that we can give to your pet, but also cost-wise, can be a little expensive. So that is another option to help with that immune response to the allergen and decrease the itch and inflammation. The side effects of this particular medication, a big one is vomiting. A lot of people will, or a lot of veterinarians will tell you to freeze the capsule. Sometimes they'll help with the vomiting. Sometimes it's just going to be limited vomiting for the first week or two, and so we just try to get through it. Maybe send some anti-nausea medication to try to get them through it. Some dogs just never tolerate it, but that'll be something that you and your veterinarian will have to decide, is this worth it, or should we try something else? But it is still a very valuable treatment option for allergies. So why not steroids? I mean, steroids like prednisolone, dexamethasone, they're amazing. They work really well. They're very fast, and they're cheap. So why don't we use them? Acutely, we do. So in a flare up, we absolutely will use them. But long term, there's a lot of side effects of steroids. So if we can avoid them, we try to as best we can. We try to exhaust all the other treatment options before we go to steroids for long-term use. And kind of the big reasons for that, short-term wise, you may see increased urination, drinking, big appetite as well, panting. Long-term though, it starts damaging organs, it suppresses the immune system. It honestly will affect every tissue in the body. So steroids, we do use them a lot still. Usually, like I said, for rescue during a flare-up, we'll give it to them so that we just calm that inflammation down as best we can, because steroids work wonders with inflammation and getting that down. But long term, if we can avoid it, we try to, as long as the other treatments work. If not, if steroids are the only treatment option, then we'll use it, but we'll monitor blood work routine and just routine exams just to make sure they're not having any side effects from it. So I mentioned topical therapy. I love topical therapy for allergies, especially atopy or environmental allergies. Um, don't underestimate topical therapy. It works really well and can lessen the amount of medications you need overall by using shampoos and topical mousses and ointments. And they usually have 3 jobs that they do. They're usually antibacterial, using things like chlorhexidine to fight any overgrowth of bacteria. They can be anti-yeast or antifungal, so having ingredients like miconazole or ketoconazole to take care of any overgrowth of yeast and yeast infections and all that. And a lot of times we also will have ingredients in the shampoos that will help soothe and repair the skin barriers, such as oatmeal, ceramides, fatty acids. A lot of these shampoos will have a combination of these things depending on what your veterinarian sees in your own pet. And so they'll prescribe a specific shampoo or topical therapy of some sort for maintenance to help keep the infections away, as well as soothe the skin and keep that skin barrier okay. So as far as when you do visit your vet for allergies, I want to just kind of go through that and let you know that allergy workups are a lot. There's going to be a lot of follow-up exams and rechecks and testing and all that, and it can be very frustrating. It is frustrating for us as well as veterinarians, but unfortunately, there's no single instant test that test for all the allergens or allergies. Said we have a kind of step-by-step process, and we do go in order so we don't miss anything, and it does take time. So be patient with your veterinarian, and we have to have patience as well in trying to take care of these allergies. So usually when you come in to visit your vet, first thing is a thorough history and physical exam, and checking for, is there any signs of infection? Where is the allergy located? Is there any signs of fleas? Anything of that nature. Good history is huge for us, so make sure to give us as much specifics as possible with the allergies, as far as what you've tried to take care of the allergies. When does it happen? Where is it happening on the body? Just give us as much information as possible. And it does help us to kind of guide where we need to go as far as treating these allergies. We may take some samples of the skin to verify if we have a bacterial or yeast infection, or from the ears as well. Then obviously we'll be taking care of that if there is something. One of the first things we do, like I mentioned before, is that we're going to rule out fleas. So we're going to recommend and put you guys on put your pets on a good flea control. We may also recommend diet trial if we're worried about food allergies. So getting them on, like I said, a novel diet, something they've never been on before, making sure that they eat nothing but that diet, or a hydrolyzed protein diet, because a lot of these pets that come into us, they've kind of been on multiple different foods, so we can't really verify what they have or have not been on. So to make it easy, we put on these hydrolyzed diets, so it doesn't matter what they've been on, and we try that diet out, like I mentioned before, for about 2 to 3 months, and we see what the response is for that. We might recommend some allergy testing, either blood or skin. And the point to this is to see what environmental allergies they have. This is not used for food allergies, is not consistent with for food allergies. I know a lot of these panels include a food allergy panel on it, and that's fine, but we cannot rely on that. The only way is doing a food elimination trial for food allergies. And then with that, we see what they're allergic to, try to eliminate those allergens, or try to desensitize them to those allergens via immunotherapy. And we'll set up a long-term plan for the allergies. It might be regular checkups for that, especially if they're on medications like Apoquel, just to make sure that we're not having any issues with infection, that they're just not itching now because they're on Apoquel, but they still have an infection. So a lot of times we'll have routine checks, maybe blood work, just to make sure their organ function is doing fine, especially on things like Apoquel and cyclosporin and steroids. So this will be an ongoing management thing. This isn't a one and done thing coming into the veterinarian. And we do go in this order. Some veterinarians will go in different orders, and that's fine as long as the steps are taken so we don't miss anything. One second. There we go. So sorry about that technical difficulties. So the takeaways are that number one, itching is a medical sign. This is not a quirk. This isn't a bored dog. There is an underlying issue, and you should be taking care of that. Number two, the cause guides our treatment. Each one of these pillars of allergies, whether it be fleas or food or environmental, each one is treated differently. So we have a different approach to them. Number three, like I mentioned before, we are controlling these allergies. We are not curing these allergies. But with the right plan, we can eliminate majority of the flare-ups and hopefully have a happy and itchy-free pet, and hopefully you can get some sleep. Like I mentioned at the beginning of this webinar, I am very passionate about client education, and so I made this YouTube channel to help educate clients, but also just recently I made a community on school. It's this application that basically with this community, if you join it, There will be live question and answer sessions with myself. That way you can ask any questions you have about your pet and their either their medical condition or health in general, and just get some clarity on whatever it is that you need for your pet. These live Q&As will also be recorded and stored in this community, so you can refer back to them at a later time. You can ask questions in discussion board on the community where the community can help with that, or I personally will be on there answering those questions. There'll be resources on there that can help with things like with allergies, a checklist, or other resources that help with certain issues and everything, and much more to come. Hoping to tailor this to help you guys out as best we can. Feedback obviously is appreciated and everything. So if you're interested, the QR code's over here with also the URL. So if you wanted to join the community, by all means, it's up and running, and would love to see you there. All right. Let me see if there's any questions. Jocelyn, is there any difference between a food allergy versus food sensitivity intolerance? So there is technically a difference. It is your body reacting to an ingredient in the food improperly. Usually with food intolerance, that's more of a gastrointestinal signs like vomiting, diarrhea, decreased appetite, stuff like that. While with a food allergy, that is also that signs, but also have skin issues as well. So that's usually the difference. But it is your body reacting differently to these allergens. Trying to go in order here. Sorry, 1 second. My pet started licking her paws, but it's only during warm weather. Can they have seasonal allergies like humans? Yeah, absolutely they can. It can be a seasonal allergy. Most likely if it is just during the warm weather. So definitely go to your veterinarian, and hopefully they can figure out what that is, maybe with an allergy test, and take care of that. My indoor cat should be on flea control still, even though they don't go outside. Absolutely. Fleas don't care if they're inside or outside. They can go inside at any time via yourself. They can just, walk through the door if they want to. Even if I've heard people say they're in a gated community and they don't need flea control, but fleas don't care about that. So please, even if your cat is strictly indoors, put them on flea and tick control. I've heard people get allergy injections for their pets. How long does it usually take to kick in? How effective it is? I'm assuming we're talking about immunotherapy. And there is schedule that depending on if you do the injection versus the sublingual drops. You can do that if you don't want to do injections. Usually the sublingual drops are every day versus the injections. You start off like every other day, and then it spaces out every 3-4 days to twice a week, every 2 weeks. Usually we like to do these therapies for at least a year to see an effect with it. So you're still trying to take care of and treat those allergies in the meantime, but hopefully as the allergens start to have a decreased effect on the body, we won't have to do as much treatment for the allergies. When we lived in California, we took our pets there. Okay, thank you. I appreciate it. Love the slides. Thanks. Thank you very much. Informative. You're welcome. Thank you. Do pets ever get over allergies, or is it a lifetime condition? Jay, it's a lifetime condition. They always have allergies. It never goes away, unfortunately. Can it change over time? It can get worse. Can it get better with, the immunotherapy, and trying to avoid those allergens. But once they have allergies, they're always going to have allergies. All right, I think that's it as far as questions. Thank you very much for joining. You guys have a great rest of your evening, and take care.